Hi, it's the nursing professor here. We're still on that road to finals in order for you to be successful. So today we're actually going to talk about behavioral health. So when we're talking about behavioral health, we're talking about both mental health and mental health illness. Okay, because they're two separate concepts. So be very careful that when you're answering questions that you understand if they're talking about somebody who's mentally healthy or someone who is mentally ill. So if a person is mentally healthy, those are people who can cope. They can adapt to all the changes, all the life things that we have to do on a daily basis, all the stressors. A person who's suffering from mental illness, they do not have those appropriate coping skills. They do not give an appropriate response to stressors, and we consider them to have maladaptive behaviors. All right, the other thing to be familiar with is the neurotransmitters. Frequently, mental health illness results from an imbalance in neurotransmitters, and there are a few that you should really know. One is serotonin. Serotonin is associated with mood, sleep, hunger, pain. Dopamine is feel good. It's all about pleasure. Same would be true for endorphins. We know endorphins really do help us with pleasure. It helps us to feel better when we have pain, those types of things. Epinephrine, norepinephrine. Those are two more neurotransmitters that are associated with energy, stress, attention, involved with fight or flight. Remember those. GABA, calming. It reduces aggression and excitation. Glutamate is associated with learning and excitation. Acetylcholine has been found to be associated with Alzheimer's. If a person doesn't have enough acetylcholine, then they very well could have memory deficits like those associated with Alzheimer's. All right, then we need to know Maslow's hierarchy of needs. We went through that when we were talking about assessment. So know that a person has to resolve any concerns, issues with safety at the bottom of the pyramid before they can reach any of those other attributes at the top, like self-actualization. All right, so we would need to help them be able to do that. And when I say we, I'm talking about mental health therapists or people who have been trained in that. Number 3 is actually stress response and coping abilities and use of defense mechanisms. All right. And so when we're talking about adapting coping, that means that you know what you're doing. Things that you do actually work. For example, if you have a problem, if you have increased anxiety, you know to go journal, you can exercise. That would be appropriate coping. Maladaptive coping would be that you have the same stressor and you go out drinking or drugs or having multiple sex partners, all those things that are maladaptive as far as a response to stress. Then we have several defense mechanisms. We should know those that are healthy versus those that are unhealthy. Healthy defense mechanisms include sublimation, humor, suppression. All right. Unhealthy defense mechanisms are associated with denial, projection, regression. And we've all experienced those, but understand that know the difference between healthy and unhealthy defense mechanisms. Then number 4 would be therapeutic communication. Again, we talked about that when we did the assessment video. Using open-ended questions, encouraging your person to tell you more so that you can delve into what they're actually thinking as opposed to you making judgment as to what you think might be going on. Okay, so you always want to avoid giving advice and judgment when you are encouraging therapeutic communication. Number 5 is to know the common mental health disorders. And they are depression, bipolar, where you can vacillate between being anxious or mania versus depressed, anxiety disorders, like panic attacks, excessive worrying, schizophrenia. Schizophrenia is like in its own basket. Very unpredictable behavior can result from a person who's suffering from schizophrenia. They also can be quite delusional. So it's a little more complex than one thing or another. All right. Number 6, we should know suicide risk. We should be able to assess for that. Don't let a person come in and they admit to mental health disorder and you don't address suicide risk. So you're going to ask them questions like, have they ever thought about doing it before? Have they ever attempted before? Do they have a plan? Those are things you want to make sure that you get an answer to. And if they're not thinking about it for themselves, are they thinking about harming someone else? Number 7 is crisis intervention, is you knowing how to restore psychological equilibrium. This takes a mental health professional to be able to do that. But once you identify it, then you're going to make sure that a person can give that person crisis intervention. So the phases of that are, you have the initial threat. Then it escalates. You get, the person goes into an acute crisis, and then you're searching for a resolution. Okay, so those are the phases of that. Number 8 are the legal and ethical issues associated with that. Informed consent, confidentiality, HIPAA, that the person can voluntarily commit themselves or be involuntarily committed. So to know those types of things. Number 9 is probably the biggest group that you need to be aware of, is the psychopharmacology basics. There are tons and tons of mental health drugs, as well as side effects that are associated with those. And I encourage you just to go through those, group them into classes. So you'll have your antidepressants, you know those, like your SSRIs, your antipsychotics, which are usually the drugs that's going to give you the dyskinesia, those extrapyramidal side effects. Those are things that are associated with your antipsychotics. All right, so there are tons and tons of them. I mentioned before in one of the videos about this pharmacology book. This young lady at RN Essentials did a wonderful, wonderful job at this book here. It is on TikTok, or you can go to the website of RN Essentials. You can see here that she starts out with anatomy of the brain, and she talks about all the various neurotransmitters, because usually it's a deficit. There's an imbalance in the neurotransmitters that result in mental health illness. So she identifies those and lets you know what are the signs and symptoms that you can actually see when they are out of balance. So I would encourage you to get that book. I think it's, I don't remember how much it is, but it really, really is very useful, and it's Christmas time and somebody probably can benefit from that. All right, so just real quick, these are some of the major classes of drugs. As I mentioned, the SSRIs, those are associated with antidepressants. The SNRIs, or serotonin norepinephrine reuptake inhibitors, are also associated with antidepressants and neuropathic pain. Your TCAs, or tricyclic antidepressants, are also, again, antidepressants. Examples would be amitriptyline. They are older class, and older drugs have more side effects. So you want to be aware of that, like dry mouth, weight gain, sedation, those types of things. You have your MAO inhibitors, they are things like Nardil. The thing with that is food. So remember that, to avoid tyramine rich foods like cheese and wine. That's a real important concept to recognize. And then you have the atypical antidepressants like Wellbutrin, Remeron, Trazodone. And so the great thing about those drugs is, though they're antidepressant, there aren't the side effects of sexual, not being interested in sex. And that's really important to many people. And so last but not least, you have the antipsychotics, which are used for people who are suffering from schizophrenia. You have the typical ones, which are the first generation. They, again, have more side effects. And the atypical ones like Risperidol, Zyprexa, Seroquel, and they have a little less side effects. So know your drugs. Go back and review them. And I hope this video helps. Good luck on your exam. Let me know how you do. And I will see you next video. Bye for now.